How many times have you said, I'm just getting older? Maybe you're more tired. Maybe you're forgetting things. Maybe walking upstairs feels harder. Maybe you don't have the same energy you had years ago. But here's something I want you to know. Yes, aging brings changes, but not everything should automatically be blamed on age. Some symptoms deserve a closer look. Today, I will share 5 things people often think are just aging, but may actually be your body's way of asking you for attention. Hi, this is Dr. Gani. One of the most common things I hear in my office is, Doctor, I guess I'm just getting older. Sometimes that's true. Our bodies naturally change with age. But one of the biggest mistakes I see is when people assume every new symptom is simply part of getting older. The goal of today's video is not to make you worried, is to help you know when it's worth asking questions. Because healthy aging is not about pretending nothing changes. It's about recognizing the difference between normal changes and symptoms that deserve attention. Number 1, feeling tired every day. Let's start with fatigue. People often tell me, I'm tired all the time, but that's not just my age. Sometimes it's related to lifestyle, but persistent fatigue can also be linked to poor sleep, sleep apnea, anemia, thyroid problems, depression, medication side effects, chronic illness, or other conditions. If you've been tired for weeks or months, don't automatically blame your birthday. Ask why. Number 2, forgetting more than you used to. Occasionally, forgetting a name or where you left your keys happens to almost everyone. But memory changes that are becoming more frequent, affecting daily life, or noticed by family members deserve a conversation with your doctor. Sometimes, memory problems are related to stress, poor sleep, vitamin D deficiencies, medications, depressions, or other treatment conditions. Don't assume every memory change is simply old age. Number 3, shortness of breath. Many people slow adjust their lifestyle without realizing it. They stop taking the stairs, they walk more slowly, they avoid long walks, not because they choose to, but because breathing has become harder. It's easy to say, I'm just out of shape. Sometimes that is true, but sometimes shortness of breath deserves evaluation, especially if it's new or getting worse. Remember that. Number 4, losing weight without trying. Some people are happy to see the number on the scale go down, but unexplained weight loss is not something we should ignore. If you're eating the same way but continue losing weight, your body may be trying to tell you something. The goal is not panic, it's investigate. Number 5, losing interest in things you once loved. This one is often overlooked. If you stopped enjoying hobbies, stopped seeing friends, lost motivation, or simply don't feel like yourself anymore, please don't assume that it's just getting older. Sometimes emotional changes, depression, grief, loneliness, chronic stress, or medical conditions play a role. Mental health is just as important as physical health. Remember that. Lessons I want you to remember. Growing older is a privilege. Our bodies change, our priorities change, our energy changes. That's part of life. But healthy aging doesn't mean accepting every symptom without asking why. One of the healthiest habits you can develop is curiosity. Curiosity about your own body, curiosity about new symptoms, and curiosity about your health. After caring for patients for many years, I've noticed something. The healthiest older adults are not necessarily the ones who have never been sick. They're the ones who stay engaged. They keep moving. They continue learning. They stay connected to family and friends. They ask questions, and they don't ignore their bodies when something doesn't feel right. Remember, growing older is normal. Feeling unwell all the time is not. Your body often whispers before it screams. Listen to those whispers. If you found this video helpful, I'd love to know which of these 5 surprises you the most. Leave a comment below if you like. And if you know someone who always says, I'm just getting older, please share this video with them. You never know whose life it might change. Don't forget to subscribe for more practical medical information explained in simple language. And as always, this is Dr. Gani wishing you good health.